Hey, Chiropassion Champions, Dr. Joe Borio here with you. I wanted to spend a couple of minutes with you this morning. There's a lot of chatter within the profession about chiropractic care and immune system and whether or not chiropractic care affects the immune system, whether chiropractic care, I just want to open that study up, but whether chiropractic care has anything to do with a relationship affecting how your immune system works. And then what's happened is, you got a group of docs that are out there saying, geez, get adjusted. It's going to help out your immune system, not treat coronavirus or any disease for that matter. I mean, chiropractic care isn't a treatment for that at all. Just like going to the gym isn't a treatment for your immune system, but working out in the gym means you have a better immune system, right? So, but the idea that, now it's becoming this conversation within the profession that for some reason you're not allowed to connect the adjustment or the health of the spine to the immune system. And, how have we gotten to that point is really sad. And it's inaccurate. I think you can have some people on one side say, geez, get adjusted. That's all you got to do. And everything is going to be perfect. And that's absurd. And that certainly isn't the message of the chiropractor. But the idea that you can't make or you're prohibited to make in certain areas of this country and certainly in this world, that you're not allowed to have a conversation about the health of the spine and the nervous system and how that greatly improves the immune system, that's equally absurd. That's absurd. So this is what I've got. When I say I've got hundreds of studies, I mean, I have hundreds of studies. So here's one more recent. March 2016, I've got it in the description. So think about this. Here's a study, a group of docs get together, and they're going to study the spinal cord. And in people that have spinal cord injuries, does it affect their immune system? I mean, there's a thought, right? Hey, if your spine gets wrecked, tremendously wrecked, does it affect your immune system? You know what they found? It paralyzes your immune system. So it paralyzes the ability of your immune system to function and fight off disease. In this case, it was a bacterial study. I'm sure it affected others because I have a whole bunch of other studies to show that. So think about that. You get paralyzed and you paralyze your immune system. So these people have an immune system that's compromised. So the idea that the spine and the health of the spine and the idea that the health of the nervous system is not related to the health of your immune system is absurd. It's ridiculous to even have that conversation. Now, I understand you're going to have some people on one side that are mechanists, and I don't mean that in a negative way, but, my dad would call mission control, right? So my dad would say, hey, you're an astronaut, maybe you don't need all the data per se, and then you got somebody in mission control, which is paralysis analysis. I understand that. And it'd be great to have a double-blind RCT study and say, hey, listen, this is exactly how many adjustments it requires to have this exact effect. I don't know that's even possible. Directly. But let's step back for a minute, all of us, take a breath, let's relax for a minute and say, okay, wait a minute. Does the health of the spine, the integrity of the spine, have anything to do with the health and the integrity of the immune system? So they evaluate people that are paralyzed, and what do they find? They find it directly is related. Those people that are paralyzed have a compromised immune system, and it's significantly compromised if they're paralyzed. Now, why? I want you guys to read the study a little further. Why did they do this study? That's a great question. Why did a group of doctors, neurologists, guys, most of the guys that did this other study I'm going to share with you, they were neurologists. They weren't immunologists, though they had a couple in there, right? They were neurologists. Why do I stress that? Because they were looking at the integrity of the nervous system in affecting the immune system. They weren't orthopedists looking at musculoskeletal problems. They were neurologists studying the connection between the immune system and the neurologic system. Okay, so why did they do the study in 2016? Because 10 years earlier, a group of neurologists did a study on mice to determine if they had a lesion in the spine, did it affect the immune system of a mouse? And guess what they found? 100%. So if they put a lesion in the spine of a mouse, it caused a significant impairment in the mouse's immune system. And what's even more phenomenal when you read this research is this. Where the lesion was caused deliberately in the mouse affected the percentage of drop in the immune system. So if they put a lesion in a lower area of the thoracic spine, it still compromised the immune system, but not as much as they put in the upper thoracic spine. So that reminds me of the study that Dr. Patricia Brennan did in 1990, which demonstrated that thoracic adjustments would cause a change in the neutrophils, what was called the respiratory burst, which was phagocytosis, the ability of the neutrophil to engulf invaders to the immune system. So, again, I think we have to step back and say, okay, look, you can't go out there and say, hey, I'm going to adjust you and you're never going to get sick. That's absurd. And, I don't think any chiropractor, the group of chiropractors are agreeing with any comment like that. Hey, I get adjusted and you're not going to get COVID-19 or whatever. That's absurd. Okay. And that isn't my approach. The other group is saying that, you can't make a relationship. That's absurd. That is absolutely ridiculous. And I think we need to step back, take a breath for a minute, stop looking at each other as enemies. Look at these people behind me here. Now, maybe some of you guys are repulsed by it. I don't know. But, you look at guys like Dee Palmer, and you look at guys like B.J. Palmer, and you look at women like Mabel Palmer, and you look at Sid Williams, and you look at Fred Barge, and you look at Reggie Gold, and you look at Stevenson, and you look at what they did and the commitment they made and the focus they made and the sacrifices they made to develop a healthcare profession to help people live a better quality life. That's what chiropractic is. It's out there to help people live a better quality life. It is, and I would think that all of us as chiropractors could hang our hat on that. I would think all of us could say, wait a minute, you know what? I'm going to stop tearing everybody down. I'm going to stop ripping everybody apart, regardless of which side you're on here. And it's sad that we have sides. And say, listen, you know what? We're a brotherhood, we're a sisterhood of healthcare professionals that are out there to cause a betterment to humanity. And our main focus is the spine, because you live your life through your nervous system. And the healthier your spine is, guys, can we not hang our hat on this? The healthier your spine is, the healthier your body is, right? The healthier your spine, the healthier your nervous system, the healthier your body is. Just like somebody that, is going out there at a gym, they're not out to treat migraines. They're out there to say, hey, if you work out, you're going to have a healthier body, you're going to have a healthier life, right? Somebody who's in nutrition is going to say, listen, if you eat better, right, your body's going to be healthier, and therefore you're going to live a better life. So chiropractors saying, hey, listen, you live your life through your spine and nervous system. So the healthier your spine is, right, the healthier your nervous system is, the healthier your life is. It's not even a treatment for an ailment. It's not even a treatment for a sickness and disease. It's basically out there to say, listen, if you brush and floss your teeth, chances are when you're 100, you're still going to have your teeth and your body's going to be healthier. I mean, that's really what a dentist is saying, right? And if you already have a cavity, would you say, geez, I wouldn't brush that tooth anymore? No, you might have to see somebody to get a filling in that tooth. But in the end, you're still going to brush that tooth, aren't you? And are you going to not brush the other teeth because that one already got sick? And by brushing it, that one already got a disease? No, you're still going to say, listen, the best way to take care of my teeth is to brush and floss them. And guess what? Even by doing a diligent job, you still might have a few cavities, but that doesn't mean you're not going to brush and floss your teeth. So the same idea is with your spine. you're still going to get adjusted. Doesn't mean you're never going to have a backache. Doesn't mean you're never going to get sick. Doesn't mean you're never going to have a headache. It doesn't mean you're never going to wear and tear and get some degenerative changes. But the best way to take care of your spine is to brush and floss it, to get it adjusted. That is the best. And not only that, it's really the only way to keep the spine in good, healthy alignment. But this idea that you can't make a comment. Listen, those people that are saying that, all you need to do is get adjusted, that's wrong. That's wrong. But the other group that's saying, it's all about musculoskeletal and it's got that's not only is that wrong, that diminishes everyone that stands behind me and in the 100 years of research that's already been out there. Should there be more research? Of course there should be. Should we focus more time and energy on it? 100%. But number one, stop ripping each other apart on social media. Jesus Christ, knock it off. And number two, start lifting each other up. Start having conversations that we can help more people. Because in the end, guys, I know when I get up in the morning and I go to the office and I put my pisiforms on, if you will, right? And I'm ready to go and start adjusting people and getting them healthy and serve people. I'm there to help them and improve the quality of their life. And I love doing it, and I know you guys do too. So no matter what side you're on, let's stop picking sides and let's start working together to elevate the profession and, most importantly, elevate what we do so we can help more people. Hey, this is Dr. Joe Borio. Certainly love and appreciate you. Reach out to some other docs. If you like this video, share it with some other docs. Share it with some other people. Hopefully, I think the reason I want to spend 10 minutes with you here, hopefully it will improve the conversation amongst all of us. And that's one of 100 studies that I'm going to post, guys. Okay? Love and appreciate you guys for loving what I love. May your Nate always flow from above down, guys. I'll talk to you later this week.